Well, it's not happening overnight, but with every passing week, we are watching more and more young athletes return to their chosen sports, begging the question, how safe is it to go back to the field?
Yeah, and joining us this morning is Dr. Nick Verma. He's the Director of Sports Medicine, Midwest Orthopedics at Rush. He's also the team physician, by the way, for the Chicago White Sox. So he is definitely in the know when it comes to these contact sports. So good morning to you, Doctor. Thank you for joining us.
Thanks for having me, guys.
Okay, well, the Fighting Illini soon going to be back in action along with the rest of the Big Ten. How confident are you that all of the proper safety protocols are being met now?
Well, I think fortunately we're starting to gain a lot of experience in how to manage athletes during this COVID period. I think when we look at high school sports, really the two issues are what are the risks to the community in terms of spreading the virus and creating a second surge, so to speak, as well as what is the risk to the athlete. And those are the major considerations we need to keep in mind.
Well, if we're using the word risk, I think we have to mention myocarditis. A lot of concern out there, doctor, among football players in particular. What is this condition, and do their concerns have merit?
So there was a study that was done from Ohio State that looked at a number of their athletes, and what they're looking for is inflammation of the heart tissue. And I think it's important as physicians, whenever we talk about a study, that we frame the study in terms of what's the significance and what are the findings. And what this study did was look at a group of athletes with a very powerful tool using cardiac MRI scans and was able to identify that a significant percentage of them had some evidence of cardiac inflammation. The problem is that when we look at that study, we really don't have a comparative group. So the best study would be to take a group of either non-COVID positive athletes and compare them to the COVID positive, or even more importantly, take a group of athletes that have had other viral illnesses, because we know that any viral illness can in fact cause inflammation of the heart tissue. And this is a very sensitive test that can pick it up, even in asymptomatic cases. So unfortunately, although we know that COVID can cause inflammation of the heart tissue, we really have yet to understand what's the true significance, and more importantly, what is the risk that poses to the actual athlete returning to sport?
So very interesting. You know, most of the severe cases of COVID-19, they involve people, those with comorbidity like high blood pressure, they're already overweight, maybe they have asthma. Are healthy athletes largely immune from these severe symptoms?
Well, as we've learned, certainly no one is completely immune, but we do know that all of the factors that you just mentioned, including age, comorbidities, and obesity, are significant in terms of predicting who may have more serious effects of the virus. I think it's fairly clear at this point that young, healthy individuals are at the lowest risk of having severe symptoms, but they also can have asymptomatic cases. And so I think that's what gives some people pause, is if there are asymptomatic individuals that may be experiencing some of this myocarditis or heart inflammation, how will that affect them? The problem with those conditions is they can lead to issues such as cardiac arrhythmias, or exercise can actually worsen cardiac viral myocarditis symptoms in the future. I think what we've learned, though, from our experience in professional sports, as well as now in many states' experience with high school sports, is that so far we have not seen a significant risk of cardiac events in athletes going back to sports. So I think what's important is in anybody who's had a documented case is they do need to see their physician to get cleared to return to sports prior to initiating the activity.
Let me ask you a yes or no question, and maybe this isn't fair that I'm asking you this, but if you had a son who was a high school football player, would you let him play right now?
I think as long as I felt comfortable that the precautions were in place, similar to what we're doing in other states or other sports, I would let him play at this point.
All right, asked and answered. Dr. Nick Verma. Go Sox. Thanks so much for your time this morning. Appreciate it.
Thanks for having us.